Hi, good afternoon, my friends. I'm Paul Hiltz. I'm the CEO here at NCH Healthcare, and I'm joined by two of my colleagues here, Ilya Echeverria and Dr. David Lindner. And we welcome you to this community Zoom town hall, where we're going to be talking about the hot topic of today, COVID, all things COVID, but specifically the COVID vaccine. As we sit here today at the downtown Baker campus, we have vaccinations taking place in the building next door to us. It's a very orderly process, and I'm pleased that process is going. That process is developed and being led by these two smart people to my left. I'll just make a couple of comments, then turn it over to the experts. A couple of exciting things that we've got going on here today, in addition to the community vaccinations taking place. Today is the first day that we're opening phase 1 of our brand new emergency department here at the downtown campus. That, you'll remember, was a $30 million project, and it's the first phase is opening today, which is going to add a lot of patient safety and patient comfort to patients coming to the downtown emergency department. And we remind people, and these doctors and nurses will talk about this, but NCH is a very safe hospital to come to, and we urge people not to put off emergent or urgent care. If you need to be taken care of, we've done a very good job of keeping our patients safe as they come to be treated for other illnesses. So let me introduce, on my far left is Dr. David Lindner, who really volunteered to lead this COVID task force when this virus first was recognized almost a year ago now, Dr. Lindner. And Dr. Lindner is a board certified pulmonary and critical care doctor, has treated thousands of COVID patients since the beginning of this, and has really emerged as really one of the nation's leading experts in taking care of COVID. He's been in close communication with the Mayo Clinic. We're very proud of the work Dr. Lindner and his team have done since the beginning of this, and we're pleased, Dr. Lindner, that you could spend this time with us. And we're joined by Ilya Echeverria, our Associate Chief Nursing Officer, who was just recently put into this exciting and challenging role. So Ilya, we're deeply grateful to you. And I think I will just turn it over to you to kind of let our friends know the plan here to roll out the vaccination.
Thank you, Paul, and thank you to the viewers for joining us here this afternoon. I wanted to start out by speaking a little bit about our vaccination plan at NCH and how we implemented that plan. We received 4,900 doses of the Moderna COVID-19 vaccine on December the 23rd. The same day that we received that vaccine, we started vaccinating our healthcare workers in accordance with the governor's order. In fact, that day, our first employee to be vaccinated was a respiratory therapist, Linda Pipe. We started to administer the vaccines according to those priority groups identified in the governor's executive order. The governor's executive order called for 4 priority groups, the first being long-term care residents and staff, the second being individuals aged 65 and older, the third being healthcare workers with direct patient contact at highest risk for COVID-19. And then hospitals were provided the ability or the authority to vaccinate those individuals who were extremely vulnerable to COVID-19. So our efforts initially focused on healthcare personnel with direct patient contact and highest risk of developing COVID-19. That included our employees who work in the COVID units, the ICUs, the emergency departments, our respiratory therapists, our operating room staff. Additionally, we began to expand the program 7 days later in accordance with the order to include pre-hospital workers, EMTs, paramedics in our communities. We worked with local agencies in Collier County to identify those pre-hospital workers and those emergency workers who are at highest risk for developing COVID-19. We started vaccinating that group on December 31st. Additionally, we worked with local health agencies as well to vaccinate healthcare workers with highest risk. We then looked at, on Thursday, we started taking registration to vaccinate our 65 and older population. Now, we had a very limited allocation. As I mentioned earlier, we received 4,900 4,900 doses. And the way that that allocation was determined was prior to us receiving that allocation, we worked with the state to input the number of employees that we have in our organization. There was specific information that we needed to add into the electronic system for readiness. So we had to add information regarding healthcare workers that we had and some other information. So therefore, that's how that dose allocation came to be, the 4,900 doses. In addition, we were given a small percentage of that to help vaccinate those pre-hospital worker employees. So I say that because our doses were limited. We certainly would love to expand our doses and be able to really support the rest of the community, but we had to work with what we have. I'd like to also refer our viewers to the rollout plan on the Florida Department of Health website. You can find information there regarding the governor and the state's rollout plan for the vaccination and the various priorities and venues that are being established to be able to offer the vaccine to members of our community. In terms of an NCH update and where we are with regards to our COVID numbers, and you can find this information on our NCH webpage on a daily basis, is that we have sent since the start of the pandemic 51,000 specimens for testing. The COVID-19 positivity rate for the past 7 days at NCH stands at 9.97%, with the 14-day rate for Collier County at 9.14. We're currently treating 81 patients who have tested positive. That's 4 more than we reported at our last update Friday. We discharged 33 patients over the weekend. And we have had a total of 28 COVID positive pediatric patients admitted since the onset of the pandemic. We have 0 employees quarantined due to workplace exposures, and we have 14 employees who have tested positive for COVID-19. In terms of our visitation update, at this time, we are continuing restricted visitation for the safety of our employees and the safety of our community. Since we are at a 10% positivity rate, we're evaluating our visitation hours on a daily basis, but we will continue to maintain restricted visitation at this time.
Ilya, if I could just interject, and I'd like to just compliment Dr. Lindner and you, Ilya, and I think our friends would be interested to know this. We're one of the few hospital, thanks to your team and your clinical expertise, we never did run out of capacity throughout this whole thing. We never did run out of ventilators, ICU beds, or other beds. And we, doctor, I think you can confirm this, we have always had enough of the remdesivir and Regeneron and those treatment modalities. And so people of this community should really be thankful to people like you for managing through this. So thank you.
Yes, we have kept our capacity. We continue to do so. As everyone is going to read, the new capacity issue is actually going to be in staff. And as the country surges everywhere, staff have become the new shortage nationwide.
And I want to just extend that, Dr. Lindner, thank you. With regards to our staff, I want to take this opportunity to not only thank our staff, but to thank the members of our community for really the support. We've been able to run vaccination clinics since December 23rd, 4 to 5 days a week, 6 days a week. And we've been able to do that because of the number of employees who have jumped in to volunteer and donate their time. We've had excellent support from our community members. In fact, and you get the emails all the time. I know Paul forwards me the emails all the time from community members who are reaching out, asking how they can help, how they can support us, how they can work, willing to give us time to work in our clinics. And so I want to take this opportunity to extend my thank you to those viewers and members of our community for working to support us.
Dr. Lindner, can you give the folks an update on the clinical findings and all of the different things that you're working on now?
Well, we've obviously shifted. In the past, we've actually sat here in this office and talked, and we were talking predominantly about community measures and health protective measures. And I put my hands out is to try to keep things at bay. And we are still unfortunately masking, and we have to, when we can't in distance, and people are still encouraged to wash their hands. And those are basic measures that we still have to, even though it feels like we've been saying this over and over again, but those are still the basics of public health that we need to continue to follow. However, we've now added vaccination. But with the last few months, we've had a shift from trying to prevent, and you were just talking about, we were talking about ventilators, and we were talking about remdesivir, and we were talking about Actemra, we were talking about these treatments that we have for people, and now we have tried to move more into the pre-hospital time, and with that, preventing patients from becoming sick enough to be in the hospital, and obviously preventing COVID. The two big changes have, one, been the monoclonal antibodies. NCH has been able to offer monoclonal antibodies. These are indicated for people who are COVID positive, who are at risk from coming to the hospital. And we offer that, and the outpatient infusion service is where these take place. It does require a doctor's order because it is an infused medication. And this is something that has been highly successful and is best given in the first few days of treatment. Obviously, now we have vaccinations. There have been something like 27 different vaccine projects that are going on, maybe more with that. Obviously, we know now of the two that have been approved here. And many people will know that United Kingdom just approved a third vaccine. Both of the vaccines we have right now, they're different than what we've had before. They're not new technology, and that is something I want to talk about. They are technology that has actually been present since about 2005, and around in 2010 to 2012, the methodology for finally being able to administer messenger RNA therapy was developed. And basically, there's basically a capsule there. It's called PEG, that allows the messenger RNA to get in. This is different than what we had before. In the past, people knew of vaccines as a killed, weakened, or actual part of the vaccine. This is not. This is actually messenger RNA. It basically instructs your body to make antibodies to what we've all heard of, that spike protein which causes the vaccine to adhere to a cell, similar to what the monoclonal antibodies done, and similar to our convalescent plasma. Plasma is polyclonal. It gives many antibodies. Monoclonal gives one, and the vaccine basically prevents the virus from adhering. Right now, these are armamentarium that we have against that. The major problem becomes one of production, and we have to have enough vaccine. And so the governor and the government have purchased the vaccine, and we are trying to strategically, not fast enough, but strategically roll this out to the communities at large by targeting those people who need it first. And that was determined to be the healthcare providers in direct contact with COVID. And then secondly, obviously, people at risk. And one of the biggest risks is those people who are older. And our older individuals have been prioritized, particularly here in the state of Florida, to get the vaccine hopefully as soon as possible.
So, Doctor, we are administering the Moderna vaccine,
Yes.
but it's thanks to your committee. I mean, we do have the freezers that if we could get the Pfizer vaccine, we would be eligible
Yes.
to be able to store that, correct?
There are 53 institutions in the state of Florida that have the capacity to even have the Pfizer vaccine. Both the Pfizer vaccine and the Moderna vaccine have to be kept cold. And with that, Pfizer, very cold, Moderna, cold. All the other vaccines also, by the way, have to be kept cold, just not as cold, and they have longer warm shelf lives. One of the problems of administering this vaccine is that we have to understand who is coming to us to be vaccinated. So people wonder, why can't you just show up? And that's because once that vial has been cracked It has a finite period of time before it has to be used, or you'll be throwing it away. So you have to know who is coming. It has to be orderly with that, because we have to use the entire vial with that. If you get one more person and open up a vial, you'll be throwing the rest of it away if there's not people to be vaccinated at that time.
Very good point. And we may have already mentioned, but the state is auditing our whole process very carefully. I know Thursday they were in here. They wanted to know how many doses we've administered, the names of the recipients, the ages, the connection to NCH, whether they were healthcare workers or on some other classification. And we've been very diligent, Ilya has with her committee, to make sure that we're following federal and state guidelines around this. We don't want to put at risk future shipments. So with that, maybe we could open it up to questions. And I'm sure we've got quite a few, it looks like.
Yes, we do. So the most popular question is, when are we getting more vaccines and how many doses does NCH currently have?
So at this time, since January the 8th, we've administered 3,345 of our 4,900 doses. When we're getting more vaccine is the big question. We are hoping to hear something this week. We're hoping to hear regarding our second allocation. I know there's been a very large demand, which is actually very inspiring that we have such a demand of, Americans want to get vaccinated. And I think the good news is that we're hearing from our from Moderna and from Pfizer is the anticipation that over the months of January and February, they will be releasing millions of vaccines across the country, to states across the country. So that's really inspiring. I think that we'll be able, as we get more vaccines, we're here, we want to support the community, we want to vaccinate as many Americans as we can. At this time, we're not sure when we are going to receive another allocation. When we do receive that allocation, our immediate efforts will be to administer that second dose follow-up to the first dose series that we administered.
And you've been updating our website, right, Ilya, so that folks want to know every day you're updating anything you know about future shipments and distribution?
Yes, thank you, Paul. I think that for our viewers, I would refer them to our website, nchmd.org, where we are posting information. As soon as we hear about it, we are putting it out there for our community. Another good resource is the Florida Department of Health website that has been posting their vaccine rollout plan, updates. In fact, there's some information on their website regarding text messages that you can sign up and receive ongoing texts regarding the state plan, county plans for vaccination sites and where you can receive vaccination. And then I always, of course, refer to questions specifically about the vaccine or the disease process or recommendations to the CDC site.
Thank
A couple of important points that she brought up, and that is, if you receive the Moderna vaccine, the first shot, you need to receive the Moderna vaccine second shot.
Yeah.
If you receive the Pfizer, you need to receive the Pfizer. We do not have data about crossing of the vaccines, and we do not understand. We know that most of people, if after the first shot, have developed some immunity by about day 14, and then basically you get the second vaccine, and the numbers that people have seen printed in the media of the 93 and 94% effectiveness are only after the second vaccine, and actually only after a couple of weeks after the second vaccine. So getting the first shot does not give you a license to remove the mask, to go out and to resume business as usual. And it is very important that people also follow up and get their second shot, because otherwise the percentage of effectiveness is specifically and significantly reduced.
That's helpful. Very good clarification.
Now the question is, if I get a first shot in Florida, can I get a second shot in another state?
people, when they are given the vaccine, will be given a card. It's about this big. It says CDC. It has where you got the first vaccine. It has which vaccine. And so if a person did receive one of the vaccines here and they have that record, then they could take that to another place and potentially register and be given the second vaccine there, as long as that site has been authorized to give it.
And correct me if I'm wrong, Dr. Neely, but when you get the first shot here, we automatically get you the appointment for the
Right.
second one, right?
We are registering people as part of our process, and with that, I can't comment about others, but we are trying to register people for their second shot and them getting that, because we want to make sure people get complete coverage and not incomplete coverage.
So we have many viewers who have fall under the age of 65, but they have underlying health conditions. They're wondering when and where can they go for their vaccine?
So at this time, we are prioritizing the distribution of our vaccine to those, and it's been, again, the state's focus has been the 65 and older population. As we get more vaccine in, we have been talking about looking at that age group, 65 and under with extreme vulnerabilities to COVID-19.
The governor's order has specifically only allowed here, and this is the same with other states, that hospitals have the ability to try to choose highly vulnerable people. If we are given additional vaccine allocations, that is probably going to be one of our efforts to prioritize. Now, as soon as I utter those words, that becomes a highly difficult entity to actually take place and transpire, because you have to both vet and understand who, when somebody says, well, I'm obviously high risk, well, they may not necessarily be so under the science of COVID. And so that's one of those things where, yes, people have higher risk and we want to identify them and try to process that. And people are going to have to be extremely patient, because it all depends on the allocation of the vaccine.
Correct.
Thank you.
One viewer asks, what about utilizing Walgreens, CVS, Publix to administer shots like they already do for the flu? Are they going to be offering that, and when?
That's actually underway now. So again, I would refer our viewers to the Department of Health website that outlines the plan for distribution of the vaccine. And the governor has already started sending doses to CVS and Walgreens to provide vaccinations with a focus on long-term care residents and then that 65 and older population.
At this point in time, both CVS and Walgreens, though, are only doing long-term residents. So I've seen patients who actually had been vaccinated before we actually had vaccine, and they were all members of a long-term care facility that had been chosen by the CVS and Walgreens to go into early and be some of the first to get the vaccine. And that is appropriate, because when we look at where the hospitalizations are coming, when we look at where actually some of the highest risk it has been come from, unfortunately, those care centers. And that is one of the reasons why the state has ratcheted down so many of the rules about visitation, about testing and all, directing it where some of the highest risk appears to be in the state of Florida.
Many questions regarding getting that second shot. Now that President-elect Biden wants to release all the vaccine supplies, there's some concern about getting the second shot within that 3 to 4 week interval. Question is, what happens if one is not able to get a second shot in that time frame?
The recommendation of both the CDC and most of the people who've been doing the vaccine research is that as soon as that second shot became available and you can get it, then you would do so. The timing was what was decided from the research project, and that is the recommendation, because that's the research we have. If a person was missed or late by a week, it does not diminish the effectiveness with that. It just delays the time to maximum effectiveness.
Good answer.
Are the vaccine appointments at NCH DriveThru?
At this time, they are not.
Okay.
People do have to realize that all vaccines, and that doesn't, from the flu vaccine to the shingle shot to whatever vaccine that you may get, all vaccines have the potential for having adverse reactions with that. These adverse reactions seem to be heightened in people who are highly allergic, patients who carry EpiPens, who have had reactions to vaccines before, need to disclose those to the team who are vaccinating them, because that is highly important information. However, with that, people need to realize that all vaccines have reactions. A sore arm, with that, numerous individuals have said that this one hurts the next day. Getting it? No. The next day, yes. Many people, myself included, I felt a little bit achy with that. A couple Tylenol and I was fine. There are some people who are having a temperature. Remember, this is the vaccine actually causing the immune response of your body. You're supposed to develop a reaction to it. That is the purpose of the vaccine. So since all vaccines do have reactions, right now, what do? We give you the vaccine and you are monitored. Why? Most of the severe reactions come within the first 15 minutes after the shot, and you need to be able to be monitored. That is not something we want people to drive up in a car and then drive away from immediately from. That makes it more difficult. You either have to have a parking lot where they go and the people are monitored in their car with somebody who can recognize that a person in a vehicle is having a reaction.
Next question is, are we continuing to vaccinate healthcare workers and healthcare workers who have direct patient contact but are not affiliated with NCH? Where can they get the vaccine?
At this time, our focus is healthcare workers who are affiliated with NCH, our workforce, although we did extend some of our allocation to healthcare personnel, to small groups of healthcare personnel outside of our organization. I would encourage the community to, again, look on the Department of Health website to keep vigilant in terms of keeping themselves updated. We know that the county is actually administering vaccines Monday, Wednesday, Friday for the community at 2 locations. The Department of Health location on Tamiami and North Collier Park is another location. So there are some opportunities being presented by the Department of Health for healthcare workers in the community.
And Ilya, I believe you vaccinated the first responders last week, is that right?
We did. We started vaccinating the first responders on December 31st.
Today, we specifically sent out to at least our healthcare providers a link to where they can find what has been set aside specifically for healthcare providers. We also forwarded that information to the Collier County Medical Society to send out to all of its members. But there are some specific times and places. People have to identify where they work, provide some type of verification that they are a healthcare provider involved in direct patient care, and then they can be admitted through that process with the county.
Mm-hmm.
Question is, I got my first Moderna vaccine with the Department of Health. Can I get my second from NCH or vice versa?
At this time, we do not have allocation to provide second doses. As we get more doses and more vaccines, we will be looking at helping to support the community with second doses.
Why are non-Florida residents allowed to get the shot? Is NCH offering any criteria on screening for residents only?
So unfortunately, we cannot close vaccines to just Florida residents. Again, it is a state program, but beyond the state, it's also a federal program. And I think the thing to keep in mind is that every vaccine administered, because it is a global pandemic, supports the community at large. So we are not restricting the vaccinations to in or out of state residents at this time.
And I would just interject, I know there's been a fair amount of frustration around the signups for the vaccinations and the policies and procedures. I think the team here is really just trying to adhere to the guidelines which change on a daily basis or hourly basis. But that's part of the frustration. We're in the middle of a once-in-a-lifetime event. The governor at both the state level and then the federal officials too, trying to make these policies up as we go. And we are in the position of just trying to adhere to those.
Okay. Next question is, what is the purpose of the 2 shots? Why are 2 needed?
The purpose of 2 shots with that, each time with that, as in the past, what would happen is that the vaccines would basically convince your immune system to go through what it does. Every time that we have something, we make antibodies. But it's beyond antibodies, we also have memory. There's T, there are B cells, and these things basically have the ability to recognize the foreign invader and then go ahead and produce antibodies in the body's response. In many cases, there have been that we know some things that we can give just one vaccine and your body produces enough of a response that produces immunity. But as most people know, you have gotten multiple vaccines through the years, and that is because the immune system first needs to identify, and then basically upon the second vaccine, so to speak, gear up higher to be able to produce enough of a response to keep the person safe and prevent the disease.
Doctor, will patients who have already had COVID, will they get a vaccination?
At this point in time, the recommendation based upon the science and the research is that people who have had COVID 90 days after it, so 3 months, should go ahead and get the vaccine. We have seen various and different responses of patients who've had COVID and how much of a response of antibodies. Some people who have had mild disease create a tremendous amount of antibodies. Some people with severe disease have created little. And so at this point in time, it is difficult because we do not have quantitative, that means actual, like, well, you have 10 and you have 5, that testing is very difficult. And so the recommendation is 90 days after a person has COVID for them to go ahead and start the vaccination process.
Okay. And doctor, if a person is vaccinated and has both vaccinations, can they be a carrier of COVID to another person?
So far in the initial trials of both Moderna and Pfizer, there were people who still got the disease. Now, what's important is that those people none of them ended up dying. None of them had life-threatening or severe COVID. People would have mild because of that failure rate. And if you quote 93 and 94%, essentially it doesn't take a mathematician to know that somewhere around 6 or 7% of people still were able to get COVID. That meant that people who've been vaccinated could potentially get COVID and pass it on to somebody else.
Okay.
Though, albeit that they had a disease that was mild. Now, this is similar to what we see in other vaccines, where people do have a very mild course of illness, but yet we're still potentially infectious.
Okay, thank you.
What is the % level of protection after receiving the first vaccine, and how soon after the injection?
That's an excellent question, and the data, I can say, varies somewhat. Maybe somewhere between 40 and 60%. And so people have seen that in some places, people have been arguing that we should only do 1. The main argument against giving only 1 and trying to extend the supply of vaccines is that means that maybe half the people who get it will still have a problem, and the COVID is unacceptable. So, the data suggests that about 2 weeks after the first shot, that people have had some degree of protection, and 2 to 3 weeks after the second shot is when they reach the maximal level of protection.
Next question. Are you looking for volunteer nurses to administer the vaccine?
Thank you. And again, we want to thank all of our community members who've reached out to help in our clinics and offer help with volunteering. Anyone who is interested in volunteering, I would ask to please contact our volunteer services of the hospital as we're working with that department, and we have used volunteers in our clinics. Thank you.
When can volunteers for NCH get the vaccine, and will there be a special day perhaps for them?
We actually have started vaccinating volunteers in our organization last week, and we are ongoing vaccinating our volunteers.
Has the state informed NCH of when they'll get the next vaccine, and when will the vaccine be offered once again?
We hope to hear something from the state this week. We have not received official confirmation as to when we are receiving our second allocation. We are hoping to hear that this week. As I had mentioned, we received our first allocation the week of December 23rd, and we began vaccinating our employees. We were told to use all of our first allocation and not to hold back for second doses, and that we would be receiving our second allocation so that we can go ahead and administer that second dose. So we hope to learn more this week.
I'd like to place one other, and no one has asked, but a question I've been asked, and maybe different than the population of people, but at least is some information that I want to make sure. And that is, should we vaccinate people who are pregnant or thinking about getting pregnant? And maybe while some of the viewers, that is not an issue, they may know somebody. The current recommendation and way things are looking right now is that both the American College of Obstetricians and Gynecologists and the American College of Osteopathic Obstetricians and Gynecologists are recommending that women who are planning to get pregnant or are pregnant go ahead with the vaccine. This corresponds to that which we have in other vaccines. And this is an important concept that crosses not only from pregnancy, but into other disease processes. I have people say, well, I have heart disease, should I get the vaccine? I have this, should I get the vaccine? The potential small risk that we're seeing so far in a reaction to the vaccine is by far outweighed by the risk of COVID. Even with basically, people keep hearing that COVID has a low death rate. It still has a death rate. The risk of the vaccine is considered small compared to the risk of COVID. And as of right now, I would recommend that the woman discuss this with her obstetrician and gynecologist, but the formal recommendation by the colleges of obstetricians and gynecologists is that that woman go ahead and proceed with vaccination.
That's helpful information. Thank you.
Thank you.
Could NCH prioritize shots based on age and underlying medical conditions? Some other hospitals I've heard of are only offering it to their patients and didn't know if this is something NCH had thought about.
Thank you. Again, we go back to, as Paul mentioned, the program at the state level is highly regulated. And we have those priority groups that we have to adhere to with regards to how we vaccinate and who we vaccinate. And what's important is that we vaccinate in a fair and equitable manner. And that is really what we have been doing, is adhering to the guidelines, those priority groups identified by the governor, and making sure that we do it in a fair and equitable manner.
Has NCH thought about other IT solutions for the vaccine sign up in the future, given the challenges of the first?
Yes, we have. In fact, we immediately, recognizing that we had some technical difficulties on Thursday when we opened the site for sign up for the community, we recognized the delays that occurred. We had an issue with, we had at one point 145,000 individuals accessing the site at one time. So anytime you have that type of traffic coming into a web page, we anticipate that we're going to have some delays and user experiences that are probably unfavorable. The great news is that we've already started working with our IT department, and we've had wonderful ideas. We've actually had community members who worked in the IT world and other experts reach out to us, actually send me several solutions and ideas, and we're actively pursuing several solutions for the future, and they may include, we've talked about doing lotteries or having a portal that is open 24 to 48 hours beforehand, taking a waiting list So there are a number of ideas and solutions that we are actively exploring.
Earlier, you mentioned community involvement and suggestions. Earlier today, we had a meeting with our employees via Zoom, and we were able to share with the employees that the community's been super supportive of us throughout this whole pandemic, to the point that we've received over 40,000 free meals for frontline workers since the beginning of this pandemic. And the community has stepped up with financial donations in a big way to help offset some of the financial difficulties we've had going through this with the added expense of PPE and eliminating or reducing for a period of time elective surgery. So part of this community Zoom is to say thank you to all of you for helping these frontline people take care of the COVID situation.
And the question is, how can a high-risk individual obtain monoclonal antibody treatment if they test positive for COVID but weren't sick enough to be hospitalized?
Well, that person is actually the person who should be given monoclonal antibodies. If a person is diagnosed with COVID, they're high risk for progression to hospitalization. That is who we want to identify as receiving monoclonal antibodies. That person should contact their physician, because that order can be written. If they had so at a walk-in clinic, we've reached out to the walk-in clinics, and then they can place the order, and the person can then be administered monoclonal antibodies.
Thank you.
Any sign of the UK or South African variant in Southwest Florida?
No. That's the quick answer with that. Do I expect it? Yes. And should we comment on it? To date, the key part that we're seeing with the variants is that they are more contagious. That means that they're seeing more people get it. For instance, the country that is now leading the world in cases per million people is Ireland. And they, this is an island. They had done, and yet they have it, and it is mostly the variant. It is highly contagious. It appears to affect a younger age group by far with that. Many of those people are unfortunately not practicing the best preventive behavior with that. The important thing is it is not more virulent. Virulent means, do more people end up in the hospital? Do more people end up who get it end up dying? The thing you have to interpret, and is important, is that it expands the number of patients. And we are seeing a consistent, if 100 people get COVID, we know that a certain percentage of that group will end up in the hospital. For every 100, I know that will happen. And so we've always tried to prevent it. But that is the important information about the variants.
Thank you.
Okay. If someone gets the vaccine and unknowingly has COVID-19, this person is wondering about the 3-month waiting period. Should testing be done first?
We predominantly right now do not recommend a post-COVID testing strategy. Why? The PCR is so highly sensitive that it can detect, I'm going to use the word pieces of the RNA, and this is an RNA virus, that are left over. And so people can be positive, and sometimes 3 and even occasionally 4 months out, but yet they are asymptomatic. The key strategy is that of a symptom-based strategy. If the person is no longer symptomatic and it's been 90 days, they should proceed with vaccination.
Is this vaccine likely to be an annual vaccine?
We have now moved, and we are now going to move into the realm of personal opinion as opposed to scientific fact. It is my personal opinion that it would not be surprising to see that we are going to be thinking about a COVID vaccine similar to we think about the influenza vaccine. There was some excellent research basically brought to light by, of all places, Norway, where they looked at what little coronavirus research there had been prior to this pandemic. People who had it with that still had immunity, had a lessened disease, but still were able to get this. And based upon the fact that we do not expect 100% vaccination, nor herd immunity into the 90 to 100 percentile range, I would not be surprised if for at least a period of time, perhaps even for long term, as I said, under personal opinion, that we end up needing vaccination in the future as well.
Would there be any allergies or underlying medical conditions that should preempt someone from getting the vaccine?
Excellent question. We touched on it a little bit, but earlier, and that is that basically people who have been highly allergic to previous vaccines, with that, people who have significant highly allergic conditions. We identify one of that group by those who have had the medical recommendation that they carry a EpiPen. People know about that. That is one of the devices that delivers epinephrine. People will give it to themselves like within the thigh or in the abdomen, and they press a button and it auto injects that. That group of people with that have been advised to be highly cautious, be pre-medicated, or discuss with their healthcare provider on whether or not they should or should not take the vaccine. People who have had a reaction to that is serious to the first vaccine, there appears to be a very small group of people who have what appears to be a reaction to PEG, which is the nanoparticle covering of the vaccine. That group of people are being advised not to with that. As to whether or not your oncologist, if you are an active chemotherapeutic treatment for a cancer, whether you should or should not proceed with a vaccine is something that you should do in concert with your oncologist who is treating you as to whether you go. As to whether I have diabetes, I have hypertension, I have high blood pressure, I am overweight, some of the major risk factors for COVID, those are not contraindications to getting the vaccine.
Is vaccine registration currently open at NCH?
Vaccine registration is open for our healthcare workers at this time.
But not for the general public?
Correct.
Okay. Do you have enough of the second doses with the required period for those already vaccinated?
We are actively using our first doses, and we hope to get in our second doses hopefully this week.
If someone has had, for instance, Guillain-Barre, which vaccine would be best for them, or do we know?
Again, moving into the realm of more personal recommendation as opposed to we have medical experience with that. And I would suggest the messenger RNA vaccines would be more appropriate and should be discussed with your healthcare provider prior to being vaccinated.
Will you be offering more vaccines through a drive-through? Many of us not able to stand in lines and get the shot. This is just a suggestion from one of our viewers.
Thank you. I appreciate the suggestion. I think that as we get more doses, we will be talking about how we support vaccinating our community and then the methods in which we do so.
Okay. Are you offering a wait list?
At this time, we're not offering a wait list. And again, that is really allocation specific because we don't have enough vaccines at this time to vaccinate the community at large.
Okay. So just folks, just in general, expressing frustration over being able to access an appointment. Could you speak a little bit more, Ilya, on potentially what these folks can do moving forward in the different avenues in our region for accessing a vaccine, whether it be through us or Department of Health, et cetera?
Mm-hmm. I had mentioned earlier the Florida Department of Health website that has information on their website regarding the vaccine rollout plan and the various opportunities that are available for those individuals that meet the priority groups identified by the governor in this current phase. There are some resources on that website. One is an opportunity to register to receive text messages with ongoing updates from the Department of Health regarding sites, vaccination sites that they are putting up throughout the state and in our county specifically. The second is I would encourage our viewers to continue to look on our website as well. We're posting information there as we learn information from the Department of Health, as well as we implement plans to administer vaccines when we receive those doses.
How will the public find out when more vaccines are available?
We will notify our public. When we did receive our first allocation, we notified the public both through media outlets as well as on our Facebook, our social media page, and our internet pages. And so we work very closely with the media to notify our public.
Would someone who is a pharmacist qualify to, as a healthcare provider, to meet the guidelines to get the vaccine?
So pharmacists over the age of 65, pharmacists who have direct patient contact absolutely would qualify.
Okay. Have you thought about offering the vaccine through your NCH physician offices to patients 65 and over?
We have, in fact, we are in active discussion regarding sustainable vaccine plans as we move beyond the initial phase, and the phases are expanded to include other healthcare workers outside of our organization and the community at large. We are here for the community. We've always been here for the community, and we absolutely are beginning to have conversations about how we support our community through our NPG offices.
I think it's important for people to once again remember that because of the requirement to keep this very cold and with minimal allocations being available, I don't want to waste one dose. And so trying to decentralize that and get that out into all the offices at this point in time is risks that we will have dosages that basically go unused with that, especially when your allocation is 5,000 dosages. With that. Now, that will probably be different when the allocation is, 20 and 30,000 dosages a month. I think one of the greatest frustrations people have to realize is that, like any other program, this is going to be something where, as time goes on, we are going to see significant upswing in the allocations of vaccines available to the public, hopefully within the next short period of time. Right now, we're in this period of time when we have an exceptionally restricted allocations, and therefore the government has put significant restrictions and is making sure that we do so. And we want to assure the public that we are trying to not only follow the guidelines, but provide the vaccines in a ethical and appropriate manner to the community in the manner in which we are instructed.
Mm-hmm.
Is there a risk to someone with a slightly low platelet count?
All vaccines do have reactions with that. We know that there have been reports as well, specifically in this case, of a physician in Miami who then developed after the vaccination a low platelet count. We do not have any indication that a pre-existing low platelet count is prohibits you from receiving the vaccine. And as of yet, at this point in time, no one is quite sure, though the investigations are ongoing, whether or not the physician who developed a life-threatening and ultimately fatal low platelet count in the 2 to 3 weeks after the vaccine was due to the vaccine or due to some other process.
Ilya, even though we've gone through a lot of questions, we may not get to finish all the questions because we're running up on our 1 hour. Will it be possible to put the questions and answers on the website under the COVID section?
Sure, we can do that.
So we'll work with the medical professionals here because we do have a hard stop here in about 2 or 3 minutes. Is there anything else, Sean? Any other themes that?
No, it's just, yeah.
Okay, couple additional questions. So we'll put those. So Dr. Linder, any concluding remarks? We really appreciate you taking the time away to be with our friends here in the community.
I think at this point in time, my concluding remark is going to be one that many people on this call will find rather strange. And that's the opposite. I want to address that we are still I'm very concerned with vaccine hesitancy, even though most of the people here are desperate to get the vaccine. And I think it's going to be important for the community once they are vaccinated, once they do understand, once they have received this, to share that with those people who are hesitant, because ultimately, similar to masking and social distancing, this is something that we all are together on. We need everybody to, as much as possible, to participate in this to protect all of us.
Well said, Doctor. And again, thanks for your leadership. You saved a lot of lives in this community. You've done a great job educating us and taking care of us, and we really appreciate that. Ilya, you're the nurse leader, nurse executive on this. Any parting remarks?
I think what I would say is for everyone to remain vigilant with what we're continuing to do, hand hygiene, social distancing, the mask wearing. The mask wearing does not go away even if you receive the vaccine. Is continue to practice those safety behaviors. And just learn that, again, every vaccine that we administer, whether you are in phase 1 or not, you will eventually receive the vaccine. But every vaccine administered at this point helps our community at large. We know there are more vaccines coming, and I know there's a lot of enthusiasm to receive those vaccines, but and I know it's hard to use the word patience considering we've been dealing with this for a very long time now, but we know that there is a light at the end of the tunnel. And so just remain vigilant, and thank you for your continued support.
Well, thanks to both of you. As you can see, we're really proud of these teams of clinicians that are taking care of our community, and we thank all of you for your interest. We'll do these again in the future, and again, just to keep up on the day-to-day changes, visit our website and for the latest news. But thank you all, and stay well.
Thank you.